Promotion, population, promoting our culture, promoting our tradition.
asalaamaaleykum mbokk yi seetaan Gambian Talents TV tey nag ñu ngi fii si Kanifing General Hospital lu doonoon suñ teewaay fii mooy doonoon lii di World Hepatitis Day celebration World Hepatitis Day nag nekk na bés boo xam ne at bu nekk dañ ko dee celebrate fii si réewi Gambia ren nag ñii di Ministry of Health National Hepatitis Control Programme MRC UK di Gambia ak ñeneen ñëw nañ fii si Kanifing General Hospital pour commemorate ko gis nañ fi ay soldat gis nañ fi ay nit yu bëri ñoo xam ne ñëw nañ teew si bés bi tey ñu bàyyi leen nag ñu ànd ak gaay gis lan ak lan la ñoo amal tey lan moo di importance of this day and also lu tax ñuy celebrate this day because hepatitis nekk na feebar boo xam ne daf dee sonal doomi aadama torop te nekk na seen boo xam ne liver problème mostly loolu lam la dee jox kon nag ñu bàyyi leen man Fat Badji man maa leen fi nekkal tey ñu bàyyi leen nga ànd ak programme bi ba ci kanam.
بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم إني أسألك يا الله يا واحد يا الله يا أحد يا الله يا دائم يا الله يا باكين يا الله يا قديم يا الله يا ربي يا الله يا سكور يا الله يا حي يا قيوم أسألك بهديتك وسمديتك ونعوذ بيدك أني أبدا من نبيك قد سلكنا في تسبيح وتقديس والأمر أمرك فإني أمرتنا بالنجول فبرادتك إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلم تسليما نصر من الله فتح كريم سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين.
We begin our prayer in the name of the Father and of the Son and of the Holy Spirit. Amen. God our Father in heaven, we thank you, we praise you, and glorify your name. God our Father in heaven, your love that has no end, we thank you for giving us our daily bread. God our Father, we thank you for the gift of life. We thank you for this special day that you have set aside for us to realize your love. God our Father in heaven, we continue to glorify your name. You made this day possible. You guided us in the planning of this day. May it continue to be fruitful to your beloved people of this nation. You love the world so much that you have bestowed your powers to your most powerful archangels. To Angel Gabriel, you've given him the wisdom to share your messages. May that wisdom be filtered to your beloved people of the country, so that all that will be shared here, discussed here, will be understood and will be adhered to by your beloved people. Regional Director of Western One, representing the Honorable Minister of Health, Mr. Momodu Gassama, representing the WHO country rep to the Gambia, Dr. Sek Omar Bite, Head of Hepatitis Clinic, Edward Francis Teaching Hospital, Dr. Jibril Ndao, MRC Hepatitis Group, Major Buba Jaju of Gambia Armed Forces, the Program Manager for National Hepatitis Control Program, Mr. Sirif Baji, Deputy Director of NAS, Dr. Jal, present here, the CEO of Kanifing General Hospital, the media, the Gambia Army Band, all staffs of the Ministry of Health and partners present here, distinguished guests, ladies and gentlemen, a very good morning to you all, and welcome to this special moment. A day that the Gambia joins the world to commemorate the World Hepatitis Day. This is an opportunity for all of us to join the rest of the world to focus our attention on hepatitis disease, raising awareness on all the interventions that will help us prevent ourselves from hepatitis. And of course, this year's theme, which we have already started, and that is time for action. And I think we have already started taking action. I know we will be taking through a lot that we need to know about hepatitis, and of course, why it is important for us to join the world to commemorate this special day. With these few remarks, I will call on the Program Manager for the National Hepatitis Control Program, Sirif Baji, to welcome all of you to this gathering.
Good afternoon. To start with, good afternoon, everyone. I will start with the Regional Health Director, Musa, who is representing the Honorable Minister of Health. Mr. Gassama, representing the WHO country representative. my colleague, my brother, Dr. Jibril Ndao, who is here representing the MRC Hepatitis Group, Dr. Seomar Bite, who is representing the Hepatitis Clinic at the Edward Francis Small Teaching Hospital, our host CEO, Mr. Drame and staff, fellow program managers here in present, Deputy Director of the National AIDS Secretariat, Mr. Ja, Dr. Ja, invited guests, members of the press, the army, band, and the police for the escort, ladies and gentlemen, all other protocols duly and respectfully observed. Good morning to you all. The world recognizes July 28 as World Hepatitis Day. Annually, the day provides an opportunity to focus action on raising awareness, encouraging prevention, diagnosis, and treatment. Globally, most people who need treatment have not been treated, likely due to lack of awareness and access to hepatitis treatment services. Hence, the theme for this year is Time for Action, which acknowledges the urgent need for testing and treatment for those living with hepatitis in order to achieve the global elimination goal by 2030. Viral hepatitis is widespread, affecting an estimated 304 million people worldwide, with an increasing global death toll rising from 1.1 million in 2019 to 1.3 million in 2022, according to WHO data. It is estimated that only 5% of the people with chronic hepatitis know their infection, and less than 1% have access to treatment. Hepatitis B and C viruses are the leading cause of liver cancer in the world, yet more than 80% of those affected with viral hepatitis are unaware of their status. It is estimated that at least 73 million people are living with chronic hepatitis in Africa. The continent accounts for about 63% of global new hepatitis B infections, yet only 18% of African newborns receive hepatitis B birth dose vaccine administered at birth. Distinguished invited guests, members of the press, ladies and gentlemen, the Gambia is attractive and has all what it takes to achieve the global elimination goal because of our small population size, the political will, the significant practical experience gained over decades of viral hepatitis and liver cancer research and care, and well-established health infrastructure. However, translating these key findings from the experience gained over decades of viral hepatitis research and care into providing healthcare services in terms of prevention, care, and treatment is what was lacking. This is due to lack of a dedicated national program to lead and coordinate national hepatitis response efforts in a sustainable manner. Thus, the decision to establish a national hepatitis control program by the Ministry of Health is indeed in the right direction, as it will not only ensure ownership and coordination, but will solely ensure sustainability of national response efforts, especially for those patients or individuals who will need lifelong treatment, follow-up, care, and then monitoring. Plans are in place to build the capacity of healthcare workers, secure hepatitis test kits and consumables, including medicines, and start treatment in few sites, preferably one in each health region across the country. In the spirit of collaboration and integration, the program intends to leverage on and integrate fully with TB and HIV programs. The existing TB HIV treatment sites will be assessed to also integrate hepatitis services and probably will refer to infectious diseases clinics. These sites will not only promote service integration, but solely or undoubtedly will reduce the stigma faced by people living with HIV, thus promote the uptake of services. Currently, people who need hepatitis services in this country are referred to either the hepatitis clinic at the Edward Francis Small Teaching Hospital or the MRC Hepatitis Group, thanks to colleagues Dr. Seomar Bite and Dr. Jibril Ndao for their continued support and unending collaboration. Distinguished invited guests, members of the press, ladies and gentlemen, I would like to appreciate and extend our sincere gratitude to the World Health Organization country office for their unwavering support in the fight against hepatitis. The country office, for your information, have supported the ministry dearly in developing both a national hepatitis policy and strategic plan 2018-2022. However, given the present time frame, the ministry felt the urgent need to review and update both the policy and strategic plan to accommodate new developments and innovations towards a comprehensive hepatitis service delivery. The WHO country office already secured funds to support this review process to ensure that the country is at speed with the current best practices in terms of policy direction and strategic interventions towards hepatitis elimination. WHO country office is again ready to associate with the country plan to conduct population-based study on viral hepatitis, just to highlight a few. In March this year, the Minister of Health also received a delegation from Africa CDC to the Gambia. The visit was a significant milestone as comprehensive assessment was conducted to identify the current capacity of National Hepatitis Control Program, with the aim of supporting national efforts to achieve elimination goal by 2030. A technical report for your information was produced and then shared accordingly with the Minister of Health authorities and partners. I am happy to inform this gathering that the Africa CDC is very keen in supporting the country conduct a zero prevalence study. Africa CDC has also committed funds to support a joint collaborative effort with the National Hepatitis Control Program and our National EPI program to conduct a national stakeholders meeting to strengthen hepatitis B birth dose vaccination. In conclusion, ladies and gentlemen, I wish to welcome all of you to this important occasion, and let's remember that it is time for action. It is time for testing, it is time for treatment, and it is certainly time for us to take action by working together to create a future free of the burden of hepatitis. I look forward to a continued support and unending collaboration towards the national response to eliminate hepatitis as a major public health threat by 2030. On that note, I once again welcome each and everyone and wish everyone a very successful deliberation. I thank you all for your kind attention.
Thank you very much, Program Manager, Mr. Serif Baji, for that insightful speech. Now I invite Major Buba Jaju for a statement.
Good morning. The Director Region 1, ably representing the Minister of Health, Mr. Gassama, ably representing the WHO country representative, the EFSTH hepatitis clinic team, led by Dr. Bitey, the MRC hepatitis group, led by Dr. Ndao, Program Manager, NHCP, representatives from the Gambia Armed Forces and the band, the CEO, Kanifing General Hospital, who are hosting this celebration, ladies and gentlemen, all other protocols respectfully observed. Hepatitis, particularly the hepatitis B, this actually, there is an inflammation of the liver, and the transmission is through blood, semen, and other fluids from persons infected with hepatitis B, which enters the body of someone who is not infected. This can happen through various ways, including sexual contact, blood transfusion, sharing of needles and syringes, drug injections, and then from mother to child transmissions. Hepatitis B is highly infectious and not currently curable. The job of the armed forces demands healthy personnel, not just the availability of arms and ammunition. And with the armed forces, there has been instances wherein because of hepatitis, people could not be deployed for some overseas missions, and some had to be repatriated because of complications from hepatitis. There was a small research that was done within the military. This included 532 military personnel who were tested for hepatitis B virus. This was in December 2018. And the people who were tested during this period included those going for UN mission, and then those for re-engagement medical exam. And 76 people were found to be positive. Out of these, 71 were male, and then we had 5 females. However, within the military, we noticed that we still need to do much more research about the level of awareness of our personnel. And then we also noticed that, like I said earlier, we have people who had to be repatriated because of hepatitis B. And another area that the hepatitis actually affects the military is in the area of recruitment. And we noticed that the problem is not just in the military, but even in the civil sector. A lot of the people who come for recruitment don't know their status. And then during the recruitment process, a lot are found to be positive. And because of this status, they are dropped from serving in the military. So hepatitis actually affects all areas of society. And the Gambia Armed Forces is committed to join in this fight. And with the elimination of 2030, GAV is actually on board for that. Thank you all for your attention.
Thank you, Major. Thank you very much for the insightful. We need first to know about the disease. We need to know about hepatitis. We need to know, to be able to prevent ourselves. It's important for us to know how you get the virus. And that's very good. If you know it, then you'll be able to know what to do to prevent yourself. The speeches, the few speakers that spoke also reveal that we have many people who are living with the virus, but they don't know. And the few ones that even know that they have the virus, they don't know where to go to. I think from here, everybody will be enlightened, and everybody will know the importance of testing yourself so that you know. I will invite Army Band to entertain us with short music. Thank you very much, Gamban. I now invite Dr. Gabriel Ndau of MRC Hepatitis Group for his remarks.
Thank you very much. Colleagues and partners from the WHO, the Africa CDC, the various Ministry of Health programs, the Regional Health Directorate, the Gambia Armed Forces, from the Edward Francis Small Teaching Hospital and Kanifing General Hospital, distinguished ladies and gentlemen. In the 30 seconds that it took me to say my greetings, one person has died from viral hepatitis. Every minute we lose 2 people. This is an urgent priority. And it does not have to be so. Most of those who die from viral hepatitis die because they did not know their status. As the previous speakers have said, less than 1 in 10 people who are living with viral hepatitis know that they have the infection. And because they do not know their condition, they are unable to seek help. And help is available. The most important viral hepatitis diseases are hepatitis B and C. For hepatitis C, there is an easy test and there is a cure that someone will take for only 3 months and they can eliminate the virus. For hepatitis B, there is a test that you do which only requires a finger prick. So even for those who are afraid of needles, you can still do the test. Your results are available immediately. We have a booth there where we are offering the test today. And for those who have hepatitis B, there is a treatment that is very effective that can prevent people from dying. And for those who do not have hepatitis B, there is a vaccine that prevents people from having the disease. And the vaccine is available everywhere in the Gambia and is given as soon as after birth onwards through the EPI programs. So if we have all of these, then why is hepatitis still killing people every 30 seconds? That is because the tools we have to combat the disease is not available to people. The second reason is we do not know about these diseases. If we ask people sitting here today anything about malaria, tuberculosis, HIV, COVID, every single person will be able to say something about these diseases. Hepatitis affects more people in the Gambia than these other diseases, but we do not know about it. So because of the poor awareness, because the tools are not available where they should be available, people continue to die. And that is why the theme for this year is important. It says it is time for action. So what does action look like? For you and me, action starts by us trying to know something about viral hepatitis and teaching the next person what we've learned about it. The information is available through our healthcare providers, through the Ministry of Health, through other resources. We should all make it our commitment to learn about viral hepatitis and make sure that our families, our friends, our colleagues at work know about it. People know where to get help. People know how to prevent themselves and their loved ones. The other thing we need to do is make sure that viral hepatitis services are integrated within the services that people normally access. We do not need dedicated specialist clinics like what we have at the MRC or the teaching hospital for viral hepatitis. You should be able to go to any health center in the country and get tested and get prevention services. We need to integrate. But these are more high-level actions that the Ministry of Health is working on. But coming back to us, what can we do? The first thing is to make sure that we know about hepatitis and pass the message on. The second thing is we know our status. Each one of us needs to make sure that they get tested, because if you have either of the two viral hepatitises, there is help that you can get that could save your life. The third thing, and this time I am talking to the employers, we need to end the stigma against hepatitis. Viral hepatitis, yes, is a deadly disease, but 9 out of 10 individuals who have the virus will live with it and die with it without any problems. Yes, it is contagious, but it is not passed through handshakes or sitting next to someone in an office. Therefore, it is not and should not be an exclusion criteria for employers. So we urge all employers in the Gambia and beyond, it is good to have health screenings before you employ individuals, but those who have viral hepatitis should be provided support but not be excluded from employment opportunities. And we call on the powers herein, the World Health Organization, the Foreign Affairs Ministry, and the other ministries to also engage international powers and governments at the highest levels to remove viral hepatitis from the exclusion criteria for travel, for scholarships and other opportunities, because this only harms people more. As Dr. Jadio has said, the military excludes soldiers from their deployment services if they are hepatitis B or C positive. And this would make the soldiers to not want to be tested. If people don't get tested, they don't get the help they need, and that increases their risk of dying from this. And finally, to wrap up, I want to urge for employers and especially the private sector in the country to support the stakeholders, to support the Ministry of Health and the government in terms of providing domestic financing for viral hepatitis services. The tests are available, the treatment is available, but it is not free. And hepatitis affects some of the poorest individuals in our community who cannot afford these things otherwise. So I call on the private sector, let one of you or more of you come up and be the viral hepatitis champion for the country. You cannot save more lives by investing in any other condition in the Gambia than you will through viral hepatitis. I thank you all.
Thank you, Dr. Ndao. Thank you for that speech. And that has even asked us to ask ourselves, what should I do? I should know about hepatitis, and I should also inform others to know about it. Test myself to know my status. And we should all know that hepatitis is preventable, is curable. So if we understand this, I don't think anybody will have that fear to go and know your status. I now invite Dr. Sehumar Bije, head of Hepatitis Clinic, Edward Francis Small Teaching Hospital. Dr. Bije, welcome.
Yeah, thank you very much, Michael. West Coast Region Director Musa Kamara, representing the Minister of Health. Mr. Momodu Gassama, representing the WR for WHO. Sirif Badi, who is the Program Manager for National Hepatitis Control Program. Dr. Jibril Ndao, who is the Hepatitis Lead for MRC. And Dr. Buba Jaju, who's also a Major in the Army, who works also in the medical team of the Army. And Dr. Jao, who is also the Deputy Director for National AIDS Secretariat. The Patients Association here, because we also have some patients who are also here. The Army Band, the journalist, and also all guests and all protocols respectfully observed. And also the CEO, Basiru, who is also here, for giving us this opportunity to be here to actually commemorate this World Hepatitis Day today. Today, I'm going to speak for the dead. I know it's actually strange, but it's the death that I'm going to speak for. I think Dr. Ndao has given you an idea of how many people are actually dying worldwide every second. For me, in the Gambia, how many people are actually dying of hepatitis-related complications? I've been practicing as a hepatologist for the past 10 years, and I've seen more than 1,000 people dying of hepatitis-related complications. And these are people who came to our clinic. And they told me, Dr. Bite, do everything to save my life. And I think about them and I say, we'll do our best. But unfortunately, our best is not enough. Because at the end of the day, our best we will do, but they will die. So imagine within 10 years, 1,000 people actually die. Imagine in a family, you have a brother who comes to us with liver cancer. And 5 years down the line, a brother also, another elder brother also comes. And this is not once, this is not twice, this is not 3 times, this is not 4 times. So what you have is like, you have 2 or 3 people within one family dying of hepatitis-related complication. You also have, I will give you a story. The first patient that was seen at MRC, at our clinic in MRC, when I was working there, was an old man. And this old man has a picture, because this picture was actually taken by Prof. Yai. So Prof. Yai, who is our head, she took the picture with him. 5 years down the line, he has a unique surname, and because of that unique surname, our nurses and field workers were able to identify the unique surname. So the son came in to our clinic with that unique surname. And what the field worker did was, do you know, she went to the picture and asked this individual, do you know this man? He said, yes, this is my father. So you imagine what was happening in that patient's mind. The third thing also, we had an uncle and a nephew coming to our clinic the same day. And the same day because they have hepatitis-related complication. They had liver cancer. So imagine an uncle and a nephew coming on the same day, and they are from the same compound, and they didn't know that they were going to meet in that clinic. And they came and met in that clinic. So imagine what would happen if one of them dies. The other would also think that I'm also going to die. So if you have 1,000 people, this is just our clinic. So you think about other people who are actually dying in the other health facilities. You think about those who are dying in Edward Francis Small Teaching Hospital on admission. So how many people are actually dying in the Gambia? It's uncountable. Just think about it in your own family. How many of us have had people who actually died, and when they died, when they were dying, what they complained of was they had an abdominal distension. They were complaining about abdominal pain and abdominal distension. So it's almost everybody, every family. Almost every family. If I ask questions here, almost everybody will say, yes, I could remember my this, my that, my that. So what it means is every family in this Gambia is either directly affected or indirectly affected. I agree with what Dr. Ndao has said. If you look at the mortality in AFSTH, liver-related complications, hepatitis-related complications are much more, much more than those who actually die from malaria, from TB, or from HIV. So this is why, for me, this time bomb has exploded. There is nothing like waiting anymore. We cannot actually wait. And those of us in the clinic know it. Because these are people who come to me and tell me, Dr. Bite saved my life. And I cannot save their life. So this is the message from those who have actually died. And this message, I'm transmitting this information to all the stakeholders here. Whether it's government, whether it's private sector, whether it's WHO, whether all institutions in the Gambia are actually affected. WHO had somebody who actually died of liver cancer. Sirif, I've never told you, but a staff who was actually posted to your unit actually died of liver cancer. You may not know because that was at the beginning. But this staff was posted in your unit, National Hepatitis Control Program, and this staff also died. So it means all institutions are affected. WHO is affected because I know somebody who came from WHO. So there is no institution here in this Gambia that does not have somebody who died of liver cancer. There is none. Because I can attest to that. Because I've written reports. The ministers will call me and say, Dr. Bitey, please, this is coming, can you help? Directors will call me and say, Dr. Bitey, please, this is coming, please help. National Assembly members will call and say, Dr. Bitey, please help. This is how serious the situation is. For me, the time bomb has actually exploded. We have missed the train. But I think we can still try our level best as much as possible. With the coming of the National Hepatitis Control Program, as I told you just now, Sirif, even your unit is actually affected. Your unit is actually affected. This I've never told you, but it is. There is no ministry in this Gambia that does not have anybody who had liver cancer. There is no private sector, whether it's ports, whether it's NAWEC, whether it's Gamtel, whether it's Gamcel, whether it's Central Bank, whether it's GT Bank, whether it's Trust Bank, all the banks, name them. This is what has been happening for the past 10 years. And we can't continue like this. We must do something. So today, as I said, I have to speak for the dead. Because the dead have spoken. They have told me, Dr. Bitey, do everything to save my life. And what that means is like, they're also telling us that we should do everything to make sure that we save the life of everybody in this Gambia. So anybody who is here in the Gambia, we must save your life from hepatitis-related complication. And this is the goal. And I think it is an objective that we can achieve. This is why the team today is time for action. So we have to act. We have to act, and we have to do everything. So with the help of the stakeholders, I think there are a few things that we can do. And those things, Sirif has mentioned them, Dr. Dow has also mentioned them. But we need all hands on deck. Everybody needs to be on deck. We need to do a seroprevalence study to know the extent of the disease in the Gambia. So this is one of the things that we have to do. Number two, we have to we should make sure that there is provision for diagnostic and treatment in this country. We cannot always say, okay, we have to rely on MRC. No. Government has to come in. Private sector has to come in. NGOs have to come in. All other UN institutions also have to come in. Because you never know who is going to be the next. The next individual could be me, could be anybody. So we have to do something to save the lives of everybody. So that's why we have to provide diagnostic, we have to provide treatment. We know that it's not a cure, but at least there is a treatment. We also thought that Sirif mentioned is like the birth dose, it has to be emphasized. Because mother to child. Can you imagine I saw a 17-year-old boy who actually came to us. I looked at his vaccination card. Birth dose was actually given 28 days. He had all the 3 vaccines. All the 3 vaccines were given to him. But the birth dose was given 28 days after. So the patient had liver cancer. And what is our birth dose rate here? It's 41%. This, for me, is not a joke. We have to increase our capacity and make sure that birth dose is actually given within the first 24 hours, because the next victim we don't know. So this story, you give somebody birth dose not within 24 hours, the effect also goes down. So please, let's emphasize on this. The fourth thing is, as health workers, we also have to need to protect our health workers, isn't it? Because the health workers also need to be healthy. So this is why I think one of the things we need to do, we have already done a pilot on that, screening and vaccination of all health workers. We can start with them. 6,000 people, it's not difficult. We can vaccinate all of them. We can test all of them. Those who are at risk, because they are at high risk, because this is a high risk population. It's not only HIV, it's not only TB, it's not only diabetes, no. Or other key population areas, no. But health workers also are a high risk group, and we need to protect them. And I think if we protect them, this is going to save us a lot of money, and we would be able to take care of the general population. So imagine a young man who is just 40 years dying. And this young man could be a lawyer. I've received lawyers, I've received magistrates, I've received nurses, I've received directors, and they have all died. So this disease has no boundary. Whether you are young or you are old, whether you are poor or you are rich, it doesn't have boundary. It can get to any of us. So in conclusion, I want to thank everybody for coming, and I hope that all stakeholders will join hands together and help Sirif. Sirif, your task is Herculean. It's not easy. You have a big task. For me, all TB, malaria, and HIV programs combined together, your task is heavier than them. So thank you very much.
Very much, Dr. Sheikh Omar Bitte. I think I'm even in a haste to get to that mini lab there. Yes. Your speech is very touching, and also is very much informative. And I encourage all of us to visit that place, even not today, another day. Also inform our loved ones at home there to visit this place to know our status. If you know your status, there is treatment for it. You will be helped. So, and if you want to know where you can receive that help, it's an opportunity. We've seen them here. Dr. Bitte is here. Dr. Ndao is here. Major Dr. Jaju is here. And of course, the program, the hepatitis control program. I think we have an opportunity. I now invite Momodu Gassama, WHO, for his keynote address.
Good afternoon, our able Master of Ceremony. I would, on behalf of the World Health Organization country representative who is not able to join us today, I would like to also stand on existing protocol to convey our sincere gratitude to the Honorable Minister of Health, who is ably represented by our regional director, my own brother, Musa Kamara. We would also like to recognize Dr. Bitte and his team at Edward Francis Teaching Hospital, our Dr. Foima Marsi, Dr. Ndao, and our colleague from the Army, and of course Patients Association, members of the press, distinguished ladies and gentlemen. Of course, I will not forget my own brother, the director of the program, hepatitis program, Mr. Shirif Baji, and everybody present here, male, female, young, old. Gratitude, congratulations to all of you on being here to attend this very important and auspicious occasion. I am speaking on behalf of the WHO rep. He has asked me to convey a short statement she would have read by herself, but because she's pressed for time for other engagements, she has kindly asked me to convey that message to you. The message is very simple and clear. World Hepatitis Day is an annual event which is observed or commemorated on the 28th of July every year. Today is 29, I know, because yesterday was a Sunday. So, but this day is observed on the 28th of July every year, and this is by the international community, including the Gambia. So we thank the Minister of Health for organizing this event. According to the WHO Director General, which is included in her statement, he said the clock is ticking. The clock is ticking on the global ambition, on the global target, on the global goal to eliminate hepatitis, viral hepatitis as a global health problem by 2030. You will recall that this is a very ambitious target. Between 2016 and 2030, the world wants, under the leadership of WHO, wants to reduce new infections, viral hepatitis new infection by 90%, and of course to reduce death by 65%. But where are we? How are we faring with this global ambition or global target? We have a long way to go, and that's why the team this year is saying it's time for action. We are not yet there, because if you still, like Dr. Bite has said, and of course our colleague Dr. Ndao from MRC has said, people are dying. This disease has no mercy. People are dying. People are getting infected. Like Sirif has already mentioned. Every year, the world, as we speak now, over 350 million people are infected, are going along with, are moving, are going with doing their business, and they have hepatitis, viral hepatitis infection. And of course, 1.3 million of those die every year. Because of two of them, of course, it's a family of 5, A, B, C, D, E. But this hepatitis B and C are the most dangerous. They are the most cruelsome. They have no sympathy, because the bulk of the infections and the bulk of the deaths, these are the two strains that cause them. So we have a problem, and that's why the World Health Organization Director General is saying the clock is ticking. 2030 is how many years away? Virtually 6 years. And yet we are grappling with 1.3 million dying and over 350 million people with this condition. And worst of it is, every single day, about over 3,000 people die. Every single day. Can you imagine this? And like Doctor has said, every 30 seconds, somebody dies. But if you calculate, if you convert those seconds into minutes, into days, so every day over 3,000 people die as a result of this very disturbing virus. But there is light at the end of the tunnel. Why are we saying this? Because we have the tools. We have the ammunition to fight. We are soldiers. We are ready to fight. So the ammunition is there. Once the ammunition is at the disposal of a soldier, obviously the sky is the limit. So we also have our ammunition. The ammunition is First, the knowledge. Like previous speakers have said, let's educate ourselves and let's educate our families, let's educate our friends, let's educate our colleagues, let's educate the public so that they are aware of this condition. Once they know, we will be able to do something. And of course, we know that we have made progress in preventing, in curing, in treating, and of course in immunizing. But these achievements fall far too short for what the global community wants. Because as we speak now, Doctor is saying about immunization. The world, as we speak globally, only 45% of our babies receive the hepatitis vaccination within 24 hours of delivery. Dr. Peter has mentioned within 20. So where is the 55%? This is globally. The picture, the situation may be different from country to country, but this is where we are. 45% of babies receive hepatitis vaccination within 24 hours delivery. The rest, either they don't have it or they receive it very late. And we all know the consequences of receiving the vaccine very late. So that's why we are faring with the world. And 80% of those with this, people with these conditions, they don't have the treatment they need. So it's only 20% that may have the treatment. 80% they don't have. That's what the World Health Organization says. 80% of people with this condition, they don't have any treatment, meaning that they are going to die slowly, as Dr. Bide has mentioned. In conclusion, what Dr. Jane wants to say is, she thanks the Ministry of Health very well for the leadership, for the commitment. Two things. The Gambia's immunization program is a solid example for this African region. The Gambia has excelled in immunization way back in the 1970s. When some of us were still going to school, the Gambia started this immunization EPI program, expanded program on immunization. So the Gambia is number one of the, if you want to cite good examples, success stories, best practice in the African region, Gambia is one of them. And he also wants to thank the same ministry by translating that political commitment into establishing a whole directorate. This has never happened in this country, all I know. We are having program directors for, but hepatitis, to have a whole directorate for hepatitis program, I think this is commendable. This is a commendable effort that the WHO is recognizing, and we are very grateful to the ministry. We applaud the ministry for this. So this tells us that there is already the political will in this country to tackle this very bad disease, very unforgiving. But again, as Dr. Gaines says, we need collective action. We need collective, no single institution can do it alone. Of course, the World Health Organization will be ready, or is always ready, to rally behind the Ministry of Health, to give it all the ammunition, all the necessary evidence that they need, the tools that they need to be able to fight this menace. Yes, the World Health Organization will continue to do that. But that is not enough until everybody participates, until everybody, we all come together to fight this very #1 enemy of all of us, a disease that has no mercy. So we need to really work together to fight this menace. On that note, Dr. Gain wants to thank the people of the Gambia, and of course the government and people of the Gambia, for the exemplary, for the government, the leadership, exemplary leadership, but for the communities for being so receptive. Our communities are doing a lot. We have to thank them. That is why the immunization coverage of the Gambia is high. If the communities are reluctant, we will not get there. So we have to singularly thank the communities of the Gambia for their excellent participation in immunization services. On that note, I thank you very much on behalf of Dr. Jane. God bless you. Thank you.
Thank you, Mr. Gazama. Thank you very much. And for your support, WHO. I think all the achievements is because of the effective collaboration that we have, and also the support that WHO and other UN agencies and partners also give to the ministry. And of course, in this, we wouldn't have achieved what we have achieved without the effective participation of the communities. Thank you very much. And I think all of us have recognized how important it is to collaborate if we want to achieve our objectives. And this mechanism of collaboration needs to be strengthened. And in strengthening it will also strengthen our action. We've heard from the speakers that something has been in place, and one of our strategy, in fact, is part of welcoming of our children when they come to this world. This is why the strategy has been there, and API and all partners also are doing very well to ensure that we give them this the dose within their 24 hours, first 24 hours on Earth here. And I think with your continuous support, WHO, we will be able to implement all the strategies that are necessary, that we need to put in place, including the one that we have started. And I am very much optimistic that we will make use of this laboratory. Thank you very much. I know the Army Band is busy with the lab there. Oh, are you intact? Otherwise, you just entertain us with the short music. There was one that you played here, and even as I saw escorts coming from that far, coming to dance. Thank you. Thank you very much. I want to strictly follow the program guide. On the program guide here, I'm seeing refreshment with musical entertainment. Are we going to have second refreshment? Oh, there could be flexibility. Okay. So thank you very much, the Army Band. And I now invite our last speaker, and that is Musa Kamara, Regional Director of Health Services, for the Minister's statement.
Thank you. Thank you very much, Mr. Chairman. Please allow me to stand on existing protocols to extend salutation on behalf of Director of Health Services, who could not be here due to loss of a family member, and to read the statement of the Honorable Minister on this auspicious occasion. The President Representative of World Health Organization, WHO, the Program Manager, National Hepatitis Control Program, the CEO, Kanifing General Hospital, the EFSTH Hepatitis Control Focal Person, Dr. Bitte, the Army Band, the MRC Hepatitis Control Group, Dr. Ndao and team, the CSOs present, program managers, directors and senior staff of the Ministry of Health, and partners, distinguished ladies, gentlemen, and all protocols duly and respectfully observed. I read the statement of the Honorable Minister as follows. Fellow Gambians and residents of the Gambia, on World Hepatitis Day, the Gambia joins the rest of the world in raising awareness about viral hepatitis and embracing this year's theme. It is time for action, acknowledging the urgent need for testing and treatment for those living with the viral hepatitis. World Hepatitis Day is observed on July 28 every year to bring the world together under a single theme to raise awareness of the disease and the impact of the disease on the impact it has on the whole world. The day provides an opportunity for all stakeholders and partners working in the areas of hepatitis to talk about the disease, their work, and what more needs to be done to promote prevention, diagnosis, and treatment to achieve the global elimination goal by 2030. Fellow Gambians and residents of the Gambia, viral hepatitis does not restrict itself to one specific region or people, but it is found worldwide, making it a global epidemic. The updated WHO estimates indicate that 254 million people live with hepatitis B and 50 million people with hepatitis C in 2022. Over 1 million of these people die each year, and many experience reduced quality of life as a result of chronic liver disease, such as cirrhosis and liver cancer. It is estimated that only 5% of the people with chronic hepatitis know their infection, and less than 1% have access to treatment. Yet hepatitis is fully preventable and treatable. Hepatitis B and C viruses are the leading cause of liver cancer in the world. yet more than 80% of those affected with the viral hepatitis are unaware of their status. In the Gambia, previous research has shown that nearly 1 in every 10 individuals is infected with hepatitis B.
Communities for being so receptive. Our communities are doing a lot. We have to thank them. That is why the immunization coverage of the Gambia is high. If the communities are reluctant, we will not get there. So we have to singularly thank the communities of the Gambia for their excellent participation in immunization services. On that note, I thank you very much on behalf of Dr. Jane. God bless you. Thank you.
Thank you, Mr. Gazama. Thank you very much. And for your support, WHO. I think all the achievements is because of the effective collaboration that we have, and also the support that WHO and other UN agencies and partners also give to the ministry. And of course, in this, we wouldn't have achieved what we have achieved without the effective participation of the communities. Thank you very much. And I think all of us have recognized how important it is to collaborate if we want to achieve our objectives. And this mechanism of collaboration needs to be strengthened. And in strengthening it will also strengthen our action. We've heard from the speakers that something has been in place, and one of our strategy, in fact, is part of welcoming of our children when they come to this world. This is why the strategy has been there, and EPI and all partners also are doing very well to ensure that we give them this the dose within their 24 hours, first 24 hours on Earth here. And I think with your continuous support, WHO, we will be able to implement all the strategies that are necessary, that we need to put in place, including the one that we have started. And I'm very much optimistic that we will make use of this laboratory. Thank you very much. I know the Army Band is busy with the lab there. Oh, are you intact? Otherwise, you just entertain us with a short music. There was one that you played here, and even as I saw escorts coming from that far, coming to dance. Thank you. Flexibility. Okay. So thank you very much, the Army Band. And I now invite our last speaker, and that is Musa Kamara, Regional Director of Health Services, for the Minister's statement.
Thank you. Thank you very much, Mr. Chairman. Please allow me to stand on existing protocols to extend salutation on behalf of Director of Health Services, who could not be here due to loss of a family member, and to read the statement of the Honorable Minister on this auspicious occasion. The President Representative of World Health Organization, WHO, the Program Manager, National Hepatitis Control Program, the CEO, Kanifing General Hospital, the EFSTH Hepatitis Control Focal Person, Dr. Bitte, the Army Band, the MRC Hepatitis Control Group, Dr. Ndao and team, the CSOs present, program managers, directors and senior staff of the Ministry of Health, and partners, distinguished ladies, gentlemen, and all protocols duly and respectfully observed. I read the statement of the Honorable Minister as follows. Fellow Gambians and residents of the Gambia, on World Hepatitis Day, the Gambia joins the rest of the world in raising awareness about viral hepatitis and embracing this year's theme. It is time for action, acknowledging the urgent need for testing and treatment for those living with the viral hepatitis. World Hepatitis Day is observed on July 28 every year to bring the world together under a single theme to raise awareness of the disease and the impact of the disease on the impact it has on the whole world. The day provides an opportunity for all stakeholders and partners working in the areas of hepatitis to talk about the disease, their work, and what more needs to be done to promote prevention, diagnosis, and treatment to achieve the global elimination goal by 2030. Fellow Gambians and residents of the Gambia, viral hepatitis does not restrict itself to one specific region or people, but it is found worldwide, making it a global epidemic. The updated WHO estimates indicate that 254 million people live with hepatitis B and 50 million people with hepatitis C in 2022. Over 1 million of these people die each year, and many experience reduced quality of life as a result of chronic liver disease, such as cirrhosis and liver cancer. It is estimated that only 5% of the people with chronic hepatitis know their infection, and less than 1% have access to treatment. Yet hepatitis is fully preventable and treatable. Hepatitis B and C viruses are the leading cause of liver cancer in the world. Yet more than 80% of those affected with the viral hepatitis are unaware of their status. In the Gambia, previous research has shown that nearly 1 in every 10 individuals is infected with hepatitis B.
kon nag ñoo ko gisandoor comme noo leen ko gisee team bi nii suma gannaaw niñ ko bindee it's time for action kon nag ñu ngi ñaax waa réew mi nañ jóg ñu xeex lii di hepatitis te gis nañ fi tey free screening amoon na fi képp koo xam ne yaa ngi gis mandarga yi comme yu ñu jot a wax si programme bi mun ngay dem to the closest hospital pour nga check lii di hepatitis na mun si sa yaram bi nam déet kon nag di leen jaajëfal man Fatou Badji man maa leen fi nekkaloon ak suma vidéographe bi kii di Abi Niasse jërë ngeen jëf ba beneen yoon